How does L-Dopa work for Parkinson's disease? Imagine a city where the traffic lights suddenly stop working, causing chaos and slowdowns. That's similar to what happens in the brain of someone with Parkinson's disease. In this condition, the cells that produce dopamine, a chemical messenger that helps control movement, gradually die off. Without enough dopamine, people experience symptoms like tremors, stiffness, and slow movements. L-Dopa, also known as levodopa, is a medication that helps restore this lost dopamine. Since dopamine itself cannot cross the blood-brain barrier, which is like a protective wall around the brain, it cannot be given directly as a treatment. Instead, L-Dopa acts as a precursor, meaning it is a building block that the brain can convert into dopamine once it gets inside. When someone takes L-Dopa, it travels through the bloodstream and crosses into the brain. Inside the brain, enzymes convert L-Dopa into dopamine. This increase in dopamine helps activate the dopamine receptors, which are like switches that turn on the brain's movement control system. As a result, symptoms such as slowness, rigidity, and tremors can improve, making daily activities easier and more manageable. To make sure more L-Dopa reaches the brain and to reduce side effects like nausea or involuntary movements, doctors often prescribe it with other medications called peripheral decarboxylase inhibitors. These include drugs like carbidopa or benserazide. They work by blocking the enzyme outside the brain that would otherwise convert L-Dopa into dopamine prematurely. This way, more of the medication can reach the brain where it is needed most, and side effects are minimized. L-Dopa is considered the most effective treatment for improving quality of life in people with Parkinson's disease. It can significantly reduce motor symptoms and help individuals regain some control over their movements. However, over time, the brain's response to L-Dopa can change, and some people may experience fluctuations in their symptoms or involuntary movements called dyskinesias. These are complex changes that happen with long-term use and requiring careful management by healthcare professionals. In summary, L-Dopa works by crossing into the brain and being converted into dopamine, which then activates the brain's movement pathways. This process helps to compensate for the dopamine loss caused by Parkinson's disease, improving motor function and daily living. It is important to remember that each person's experience with medication can vary, and ongoing medical supervision is essential to manage symptoms effectively and address any long-term challenges. Always consult a healthcare provider for personalized advice and treatment options.